At the time that we were saying we shouldn't be wearing a mask, there were three factors that were going on. A, there was thought to be a shortage of masks. B, there was no evidence that masks worked outside of the context of a hospital. I wear a mask when I'm seeing patients with respiratory disease that could be transmissible, like tuberculosis, a well-fitted N95. Thirdly, we were not aware of the extent of asymptomatic spread. So we said you don't really need to wear a mask. It wasn't only me. I'm picked out as the villain. It was the Surgeon General of the United States and the entire CDC was saying the same thing. So as we went from January, February, March, April, it became clear that those three things, A, there was no shortage and you could wear a cloth mask. B, the data showed that, in fact, outside of the hospital setting, masks do work. And third, to our painful awareness, we became clear that 50% or more of the transmissions were with people who had no symptoms. So that's when we said, we've got to get people to wear masks. That's what's called, Chuck, the scientific process. You make a recommendation, an opinion, and a guideline based on what you know at a given time. As a scientist, as a health official, when those data change, when you get more information, it's essential that you change your position because you've got to be guided by the science and the current data. That issue with masks is people want to fire me or put me in jail for what I've done, namely follow the science.
You are now getting attacked. As you know, many state public health officials have quit their jobs over the last year because of the unrelenting attacks that have taken place. And now you're at the focal point. What is your level of concern that we're going to discredit public health officials to the point of, look at Russia. They actually have a good vaccine, and none of their citizens will take it because they don't trust their own government.
Right. It's very dangerous, Chuck, because a lot of what you're seeing as attacks on me, quite frankly, are attacks on science. Because all of the things that I have spoken about consistently from the very beginning have been fundamentally based on science. Sometimes those things were inconvenient truths for people, and there was pushback against me. So if you are trying to, get at me as a public health official and a scientist, you're really attacking not only Dr. Anthony Fauci, you're attacking science. And anybody that looks at what's going on clearly sees that. You have to be asleep not to see that. That is what's going on. Science and the truth are being attacked.
Dr. Fauci, the idea that a government official like yourself would claim unilaterally to represent science, that any criticism of you would be considered a criticism of science itself, is quite dangerous. Central planning, whether it be of the economy or of science, is risky because of the fallibility of the planner. It would not be so catastrophic if the planner were simply one physician in Peoria. Then the mistakes would only affect that physician's patients, the people who chose that physician. But when the planner is a government official like yourself who rules by mandate, the errors are compounded and become much more harmful. A planner who believes he is the science leads to an arrogance that justifies, in his mind, using government resources to smear and to destroy the reputations of other scientists who disagree with him. In an email exchange with Dr. Collins, you conspire, and I quote here directly from the email, to create a quick and devastating published takedown of three prominent epidemiologists from Harvard, Oxford, and Stanford. Apparently, there's a lot of fringe epidemiologists at Harvard, Oxford, and Stanford. And you quote in the email that they, or from Dr. Collins, and you agree that they are fringe. And immediately there's this takedown effort. A published takedown, though, doesn't exactly conjure up the image of a dispassionate scientist. Instead of engaging them on the merits, you and Dr. Collins sought to smear them as fringe and take them down. And not in journals, in lay press. This is not only antithetical to the scientific method, it's the epitome of cheap politics, and it's reprehensible, Dr. Fauci. Do you really think it's appropriate to use your $420,000 salary to attack scientists that disagree with you?
The email you're referring to was an email of Dr. Collins to me. If you look at the email.
That you responded to and hurried up and said, I can do it. We got something in Wired magazine.
No. I think in usual fashion, Senator, you are distorting everything about me.
Did you ever object to Dr. Collins' characterization of them as fringe? Did you write back to Dr. Collins and say, no, they're not fringe, they're esteemed scientists, and it would be beneath me
I did not
do that? You responded to him that you would do it, and you immediately got an article in Wired, and you sent it back to him and said, hey, look, I've got him. I nailed him in Wired of all scientific publications.
That's not what went on. There you go again. You just do the same thing every hearing.
That was your response. And this wasn't the only time. So your desire to take down people.
You're absolutely incorrect. As usual, Senator, you are incorrect almost everything you
Well,
said.
no, you deny, but the emails tell the truth of this.
No.
This wasn't the only time. Your desire to take down those who disagree with you didn't stop with Harvard, Oxford, and Stanford. You conspired with Peter Daszak, who you communicated with privately, and other members of the scientific community that wrote opinion pieces for Nature. 5 of them signed a paper for Nature, an opinion piece. 17 signed a paper that called it conspiracy theory, the idea that the virus could have originated in the lab.
Senator, we are here at a committee to look at a virus now that has killed almost 900,000 people. And the purpose of the committee was to try and get things out, how we can help to get the American public. And you keep coming back to personal attacks on me that have absolutely no relevance to reality.
Do you think anybody has had more influence over our response to this than you have? Do you think it's a great success? Do you think it's a great success what's happened so far? Do you think the lockdowns were good for our kids? Do you think we slowed down the death rate? More people have died now under President Biden than did under President Trump. You are the one responsible. You are the architect. You are the lead architect for the response from the government, and now 800,000 people have died.
Right.
So you think it's a winning success, what you've advocated for government?
Senator, first of all, if you look at everything that I said, you accuse me of in a monolithic way telling people what they need to do. Everything that I've said has been in support of the CDC guidelines. Wear a mask, get boosted.
And you've advocated to make it coercive and done through force.
Everything
you've
that I've
advocated
said.
It be done by mandate.
Right.
You've advocated that your infallible opinion be dictated by law.
Right. So again, Madam Chair, I would like just a couple of minutes because this happens all the time. You personally attack me, and with absolutely not a shred of evidence of anything you say. So I would like to make something clear to the committee. He's doing this for political reasons. What you need to do is, he said in front of this committee.
You think your takedown of 3 prominent epidemiologists was not political?
You don't want me to finish because you know what I'm going to say.
That was the question.
Senator,
were you political in taking down these 3 prominent epidemiologists?
Senator Paul, if you would please, I'm going to allow Dr. Fauci to respond. We have a number of senators who would like to ask questions, and I would like him to be able to respond. Please do so.
So the last time we had a committee, or the time before, he was accusing me of being responsible for the death of 4 to 5 million people, which is really irresponsible. And I say, why is he doing that? There are 2 reasons why that's really bad. The first is it distracts from what we're all trying to do here today, is get our arms around the epidemic and the pandemic that we're dealing with, not something imaginary. Number 2, what happens when he gets out and accuses me of things that are completely untrue is that all of a sudden that kindles the crazies out there, and I have threats upon my life, harassment of my family and my children with obscene phone calls because people are lying about me. Now, I guess you could say, well, that's the way it goes. I can take the hit. Well, it makes a difference. Because as some of you may know, just about 3 or 4 weeks ago, on December 21st, a person was arrested who was on their way from Sacramento to Washington, D.C. at a speed stop in Iowa. And the police asked him where he was going, and he was going to Washington, D.C. to kill Dr. Fauci. And they found in his car an AR-15 and multiple magazines of ammunition. because he thinks that maybe I'm killing people. So I ask myself, why would Senator want to do this? So go to Rand Paul website, and you see Fire Dr. Fauci with a little box that says, contribute here. You can do $5, $10, $20, $100. So you are making a catastrophic epidemic for your political gain. So the
You
only
have
thing
politically
the only thing
attacked
that I
your
can-
colleagues and in a politically reprehensible
The
way
only thing that I
attacked their
could think of-
reputations. The anger that's developed with you, Dr. Fauci, is that you don't want to give us advice. You want to tell us what to do. You think you are the science, and that anybody responds to you, how dare you? How dare you criticize science? As if you somehow are science. That kind of arrogance, that hubris is really, that's where the anger is coming towards you. If you were one doctor among hundreds of doctors in the government who gave advice, I don't think anybody, people might object to your advice, but there wouldn't be such a degree of anger. But you are so certain that you're right that you're not willing to hear anyone else. 3 epidemiologists, of which you are not even an epidemiologist, but 3 epidemiologists prominent in their field, Oxford, Stanford, and Harvard. You maligned them. You spoke openly with Dr. Collins, and you did not disagree that let's paint them as fringe. You went after them and said, we will do a public takedown, not in Science or Nature or Lancet, in Wired, in The Nation, a left-wing publication. You've engaged in base politics. You wonder why there's so much anger? You're not an objective scientist. You've lost that long ago. And so many of the things that people want, it's like they want to know why you're forcing their children to be vaccinated when 95% of people at risk have been vaccinated. Over 95% of people over 65. It's a huge voluntary success. And yet you won't rest until you force every child to get this. So yes, there's a great
Senator
deal
Paul,
of
your
dissatisfaction
time has
with you, and many people want you to go, but nobody wishes you violence.
So, first of all, Senator, again, at a hearing such as this, where there are almost 900,000 people in this country have died from this outbreak, you have chosen to just personal attacks on me that go back to multiple hearings. And again, just for the record, for people to check, I have never said take people down in that email. It was an email that was sent to me. See, and again,
You agreed with Dr. Collins in the email.
Senator Paul, this is my time.
you know, you personally attacked me, and the things that you do are incorrect and proven incorrect. You've publicly accused me at a hearing of being responsible for the death of 5 million people, when there is not a single shred of evidence that anything that was done with the NIH had anything to do with COVID-19.
But she's had the flu for 14 days. Should she get a flu shot?
Well, no. If she got the flu for 14 days, she's as protected as anybody can be, because the best vaccination is to get infected yourself.
And
So
she should not get it?
if she really has the flu, she definitely doesn't need a flu vaccine. If she really has the flu,
She should not get it again.
no,
this
she
year?
doesn't need it, because it's the most potent vaccination is getting infected yourself.
This is an ongoing question, and we've had ever-evolving opinions from you, Dr. Fauci. Currently, antibody surveys show that 80% of children, approximately 80% of children, have had COVID, and yet there are no guidelines coming from you or anybody in the government to take into account their naturally acquired immunity. You seemed quite certain of yourself in 2004, but in 2022, there's a lot less certainty. One of the things that we also know after looking at this for 2 to 3 years is that the mortality from COVID is very similar, if not less, than influenza. So when we look at this, we wonder, why you seem to really embrace basic immunology back in 2004 and why you seem to reject it now.
Well, I don't reject basic immunology, Senator, and I have never denied that there is importance of the protection following infection. However, as we have said many times, and as has been validated by the authorization by the FDA through their committee and the recommendation by the CDC through their committee, that a vaccination following infection gives an added extra boost. And that film that you showed is really taken out of context. I believe that was when someone called in who had had a reaction to a vaccine and asked me through a telephone in the interview if they should get vaccinated again. So it was in the context of someone who had a reaction. And as a matter of fact, Reuters fact check looked at that and said, Fauci's 2004 comments do not contradict his pandemic stance.
Actually, words don't lie. If you look at the words behind me, we can go over them a little bit at a time. She doesn't need it because the most potent vaccination is getting infected yourself.
It is true. It is true, Senator. It is a very potent way to protect.
So when you're trying to tell us that kids need a third or a fourth vaccine, are you including the variability or the variable of previous infection in the studies? No, you're not.